the idea is to plan for something that's at least several times worse than your previous experience.
It's not the message Canadians want to hear, but it's one Canada's top doctor says they need to listen to.
Right now, I think on the whole, we are on that slow burn kind of trajectory, but it doesn't take much for things to escalate.
Health officials are trying to avoid a new wave this fall that's several times higher than the first, overwhelming hospitals with smaller echoes to follow. This after weeks of warnings from public health officials underlining more cases among young adults.
There are still some of the population that are not observing some of these rules or public health advice. And so we can always do better.
The projected peak lands in the middle of back to school and coincides with the cold and flu season.
So planning for that potential convergence of the viral activity is something that we're actively doing as well.
How to keep it in check without another lockdown? Quick testing and isolation, quick contact tracing and quarantines, wearing a mask, and keeping apart. So, is Canada ready?
In many parts of Canada, during the first wave, there certainly were issues with diagnostic testing capacity, contact tracing. There certainly were some issues with those. It appears that much of that has been ironed out. It's unlikely that we will see issues with that, but it is certainly still possible.
How severe it will be depends on everyone's actions. David Thurton, CBC News, Ottawa.